we'll go ahead and get started. Thank you so much to everyone for joining us today. My name is Rachel Hauk. I'm the Director of Donation Development for LifeCenter. And we're so thankful that you decided to spend a portion of your afternoon with us this afternoon. So we have a good agenda today that we think will add a lot of value to our work together, but we always like to start off every meeting just really connecting to the person at the center of our process, which is the donor, who touches everyone who takes part in the process, from their family members to the donor hospital professionals to LifeCenter staff to the transplant recipients, for sure. So we'll have a story of a donor here in just a little bit, but first I want to go through the agenda. So we'll first have an opening from our president and CEO, Santok Gill, that talks a little bit about what happened in 2024 and kicks us off looking forward into 2025. And then we'll talk about Ben Anderson, who was an organ and cornea donor. And then a quick review of the End the Wait campaign objectives and how we've been performing. As you all know, we've been at this work for a while now in the End the Wait campaign. So we'll talk about our progress, which is really significant. And then we have a compliance update and how we're going to try to integrate our quality departments to sort of respond to the compliance update that we're seeing. But before we get into all of that, I'd love to welcome Santok Gill up to share a little bit more.
Thank you, Rachel, and good afternoon, everyone. We really are so thankful for our hospital champions and for you making the time on the call today. I know that the weather has a differential impact across the Puget Sound, so I hope everyone is safe and that you're able to deliver the great care that you guys deliver all the time. Next slide. So we are on a mission to save more lives and support more families than ever before. And we do that because we know that patients are waiting. And I'll have some really exciting data to share with you today about what we've accomplished together. And without you, those outcomes would not be possible. Next slide. Just as a reminder, I think most people realize that there are 100,000 people on the US transplant wait list. And each day, 17 people die while on the wait list, which is why we have such a sense of urgency of pursuing every donor and really trying to get those life-saving organs to people who are waiting on the list. Next slide. Just a little bit about our Washington program. So as you know, we do not have any transplant centers in Alaska, Montana, and Idaho, but we have 5 transplant centers in Washington. And we suspect that many of the residents of those other states would list at one of our 5 centers. And as of January 1 of this year, there were almost 1,500 people who were listed with our transplant programs. About 80% of them were new to the transplant waiting list. So they were added in 2024. And unfortunately, 52 people
All right, I'll go over there.
passed away while being on the wait list. But 881 people received either a deceased or living transplant. Next slide. I want to spend a little bit of time on this slide because this is what tells the story about what we've accomplished. You can see in the green bar is the number of donors that we've been able to recover. The orange bar is the number of organs transplanted. And the blue line with the big white number is the number of people who died while on the wait list. And between 2020 and 2024, in that 5-year period, together, we increased the number of donors by 48%. And during that time period, we made more than 5,100 organs available for transplant and were actually transplanted. About 50% of the organs that we recover remain in the state of Washington, and about 50% are allocated outside of the state. You can see in the blue line, what we really saw in 2024 is a decline of the number of people who died while on the wait list. And part of our vision statement at LifeCenter is that we will not stop doing our work until no one dies while waiting for an organ. And we know that we can make a real significant difference on the wait list for us locally. So while we can't draw conclusions or correlation, certainly we believe that having more donors and having more organs available has to impact the wait list across our 5 transplant programs. Next slide. Another thing that we're really proud of that you, again, facilitated and helped us with, in 2024, we ended with 437 organ donors. That's the highest single year performance in LifeCenter's history. So we again broke a record, and we continued to do better every year. And that would not be possible without our donors, donor families, and certainly would not be possible without our donor hospitals. And as a result, we saved 1,070 lives through organ transplantation. Next slide. Such an important part of what we do, as you know, is support families. We support families at that time of tragic loss in the ICU, but we support them long after. And while we're proud of the number of organ donors and organs we've made available for transplant, we're equally proud that we can continue to provide outstanding service to our donor families and give them grief support during the time that they need that the most. Next slide. This just shows the number of ways that we interact with donor families through phone calls, letters, and multiple touch points. And we're very proud that we support the donor family in that moment of tragic loss, but also long after that donation process ends. And we know that for every family, the grief never goes away, but we do try to help them understand the gift that has been given, and hopefully they can find some solace in that. And we are always there for our donor families, as you can see by the number of touch points that we have. And it's one of the things that we really want to highlight in terms of our interaction with healthcare teams, that they understand that we're there to support our families. So with that, thank you so much. And I appreciate your great support and ongoing support. Thank you.
Thank you, Santa. And as Santa shared, we do work with our donor families for long after the donation happens and long after they leave the hospital. And one of those stories is the story of Ben. And I'm actually just going to read the content that Ben's mom worked together with our aftercare program and our communications team to put together, because I think the words that they put on paper, I'm not sure I could represent them as well as they did. So I'm just going to read a little bit about Ben Anderson. So he was an active young man who pushed the physical boundaries of anything on wheels, landing 360s and backflips, going 1,000,000 miles a minute. Ben lived life fast and furious. People were drawn to Ben's energy. His friends often confided in him because he cared and understood what it felt like to be lonely or misunderstood. Adopted as a baby to white parents, Ben was deeply loved, but sometimes felt culturally isolated as a Black person growing up in Missoula, Montana, though he was eager to help others along their journeys. Every day with Ben in it was better than any day before he came into our lives, said Eden, Ben's mother. In May of 2024, at the age of 20, Ben was severely injured in a motorcycle accident doing what he loved most, going fast. His mother honored Ben's life by choosing donation to save and heal others. As he'd come into his young adulthood, Ben's group of friends had grown considerably. And during the entire last week of his life, there were at least 20 young adults at any given time sitting vigil in the hospital. As Ben was wheeled down the hospital corridors for his honor walk, the staff told his family that everyone lining the halls was one of the largest gatherings that Providence St. Patrick Hospital had seen in a long time. Ben's death created opportunities to save the lives of 4 people who received his fiercely loving heart, his liver, and his kidneys. His corneas also restored sight to 2 other people. Eden especially thought about the mothers of his organ and cornea recipients, since Ben gave the gift of life and sight during Mother's Day weekend in 2024. The fact that he was able to give life is meaningful, said Eden. His life means something. So I think Ben is just an example of one of hundreds of stories like his, of the impact of the gift of life, of donation. And I think, as you heard in the words that Eden had put together, the hospital staff was very impactful in her journey and supporting his honor walk and supporting many of his loved ones and friends and families coming to visit him. And so we can't take for granted the amount of collaboration and support that we are all giving the donor families, and that it truly is a team effort that we could not do alone. Which brings me to our In the Wait campaign update. And really and truly, it is all about us working together. And as I said, we've had the In the Wait campaign for several years now. And just a quick review, our objectives haven't changed. They're pretty simple: connecting with families, eliminating early extubations, and honoring donor decisions. They're simple to say, they're not simple to do. But the goal is to achieve a donation rate of 75% or higher. So in 2024, our donation potential in our service actually increased, in our service area actually increased by 12%. So we had 750 potential donors in 2023 and 842 in 2024. And despite that, we actually made improvements in nearly every category here. So we had a 1% increase in our timely vented referral rate, and this is across the entire service area. So it is not a small number. I know 1% sounds small, but when you put it across 200 and some hospitals, it is quite significant. And we have a vented referral rate of 91%. We saw a 1% improvement in our missed referral rate. So only 3% of our referrals were missed in 2024 or 2023. Sorry. Wait, no, it's 25. Sorry, I don't know what year it is. 2024. And then we saw a 1% improvement in collaborative conversations. So we're at 91% of the conversations that happened with families last year were collaborative, which is what we want. And we also saw a 1% improvement in donor registry oppositions. So again, all of those seem like small percentages, but when you look at them across the board and across our entire service area, it is truly impactful. So what does that look like by region? So eliminating early extubations, and the amount of green is the amount of improvement last year. And I want to call out that Montana and Eastern Washington had way less room for improvement. So we don't want them to feel that they haven't improved. But you can see that every single area that we serve saw a decrease. And in less than 4 years, we've seen a tremendous decrease, 8.9 to 5.3%. And that is work that we have done together. That is work that you all have looked at your processes, determined how could we make this better? How could we make sure that we make every referral call before the patient's extubated? How do we ensure that LifeCenter has enough time to do the evaluation before we extubate the patient? That is all work that you all have done and is reflected in those numbers that Santok just shared with us, year over year increase in the number of donors. Another thing that we've had a significant amount of success in is honoring donor decisions. If you look back at 2020, which is about the time that we began talking about this goal of honoring 100% of the donor registry or patients who had registered their decision to be a donor, we were not honoring all of the decisions. Clearly, look at the graph and you can see what a difference we have made together. And it hasn't been easy. Every single time that a family is not supportive of the registry, it is difficult. It is not a simple task, but what we have seen over and over again from our hospital partners is if you have a process in place, if you have supportive leadership for the registry, and we have systems that we can come alongside those families and support them through the donation decision and also care for them throughout what may be a traumatic time for them and something they may not agree with and may not have chosen for themselves. But we have seen tremendous success, and that is because of your partnership, and we thank you for that. So we will continue. We know that we can continue to improve these numbers because we've been seeing that we've improved them each year that we've been working together in the WAIT campaign. And that brings me to the compliance update and our quality integration. One of the things that I've been talking about already and that you all know is that we are an interdependent system. There is no way that we can get a donor organ to a transplant recipient without the donor hospital, the organ procurement organization, and the transplant center all partnering together. And each of us has a part to play, and each of us must work collaboratively with the other one in order to make that successful. it truly is against all odds that anyone gets a transplant. It is not simple. It takes many, many hands in order to make that happen, and a lot of people working really hard to do that. So I wanted to break this down a little bit further, and this is very foundational. So you can look at this slide, and it does not encompass everything that is done by any one of these organizations. But we kind of broke it down in terms of what CMS says in terms of the conditions of participation them should be responsible for. So the donor hospital is responsible for making that donor referral call. The organ procurement organizations or LifeCenter is responsible for family conversations, medical suitability, allocating the organs, recovering the organs, making sure they get preserved and transported to the appropriate place, and then facilitating that donor or family aftercare that we were just talking about. And then the transplant centers are responsible for sewing in the organs and taking care of those transplant recipients in follow-up. So we each have our pieces to do, and the CMS and the federal government tell us kind of which aspects we are most in charge of. And they do that through the conditions of participation. So we have actually been notified. So the Health Resources and Services Administration, or HRSA, has directed the OPTN, which is who we submit our data to, about all manner of things, about the referrals that we get from you all, our donor outcomes, many different things that that we have to submit to them. They will begin asking us for more information on all ventilated patients. And this will actually give them a better sense in terms of what is happening on each patient and how are the OPOs and the hospitals partnering together. So the data that I'm going to talk about today that we are going to begin reporting to HRSA is new data. We have not been reporting it to them up until this point. And we've seen a lot of regulatory changes, different data directives coming out of HRSA over the last several years related to organ donation, all with the intention of saving more lives. They are acutely aware of the individuals on the wait list that are dying every single day, and that we know if we were able to provide them a replacement organ, that they likely would not die. So CMS is very interested in us working well together and all of us working in collaboration to ensure that we are getting as many people transplanted as possible. And also allowing as many people the opportunity to authorize for donation as possible. So we expect that the information that I'm sharing with you today will be finalized later this year. We expect that we would begin reporting the data later this year, and that we should get more information coming up in the spring. These data directives have already been open for public comment, so they're kind of moving through the process with CMS in terms of when they would require us to report it to them. So what the idea is that it will actually give them and everyone more insight into the donation process. So what is the true donor pool? How are the OPOs and the donor hospitals working effectively to maximize the donation potential? So I'm sure the question you're wondering is, what are you going to report and how does it affect us? So we will be reporting new information on every referral that would include additional patient demographics and death details. It would include the registry status of every patient and whether or not the family objected to that first person authorization. It would include things like our processes. So what was our on-site response time? How quickly did we return, get to the hospital? What was our evaluation and authorization process? Specific details around those processes. It will also require us to report, when did we complete our death record review? So you may or may not be aware, but LifeCenter is responsible for reviewing all deaths in hospitals that could potentially be organ donors to ensure that the compliance with the COP is met. We currently don't record to HRSA what date we complete that death record review. So that information will now be reported. What happened to the case? They were a donor, they were a family decline, we ruled them out, all of that. So what is the case disposition? And then hospital interference details. We put that in quotes and we put it in bold because that is not our language. We do not want you to think that our language is hospital interference. This is the language that came from HRSA to us. So we can share a little bit more about what that means. But so I think that's the part that would be new. For you all, completely new. So the excerpt from the data that they want us to collect on each patient record. So this is every single, really death, because even if you weren't to refer them to us when we do our death record review, we'd need to collect this information. So looking at, was the patient referred to the OPO? Was it timely on the referral? Was there an unplanned extubation after the referral was made to the OPO? And did the hospital block the OPO's approach for authorization? They also require us to collect, did we share that information with the hospital? And did the hospital accept a remediation plan? So we anticipate, as I said, that this would be published in the spring of 2025. You can also see, if you're familiar with the hospital COPs, that the things we are collecting align very, very closely with what the hospital COPs for organ donation and tissue donation are. Those are well known. The difference is that it will actually provide additional data sources to CMS that they haven't previously had. So when the surveyors come to the hospital at the moment, they don't have this information. They don't have hospital level detail, patient by patient detail. They may ask you about your donation program, and likely what you would do is share the reports that we have shared with you. You would point to, oh, we have a donation council, or we've had, training in this capacity. But they would not have the level of detail that we're going to be providing them, required to provide them going forward. So that will allow them to have additional information when they come into an audit. So having looked at this, we want to make sure that we're setting our hospitals up for success, that that you all and us are partnering anytime there's a missed opportunity, with the goal, of course, that we would have improvement, which we've already demonstrated by the numbers that I mentioned earlier, that improvement is possible, and we've done a lot of that together, and also saving more lives. That is the underlying push for all of this. It is not about compliance or regulations. It's ultimately about that recipient at the end getting their lives saved. So LifeCenter, we spent a good bit of time internally as we were looking at this data directive and wanting to make sure that we are partnering with you all, so that you have, if CMS were to come in and say, hey, I noticed you had 2 missed opportunities for organ donation. What did you do about them? Then you actually have a well put together package that you could demonstrate. Actually, we worked collaboratively with LifeCenter to conduct a root cause. We identified and created a corrective action plan, and we've been monitoring and implementing it. So this is a process that, in general, we've been doing with LifeCenter for a while, but we have been facilitating it through our hospital development program managers, who are all, you know them, they're individuals who work with you day in and day out about your donation program. And their expertise is not root cause analysis. It's not quality necessarily. So what we decided is that we would actually involve our quality department to add that expertise to this process, in order to hopefully add additional value to the missed opportunity review process, and also to be able to produce a package, if you will, between you and us to make sure that you have what you need. So I'll kind of walk through briefly what the overview of the process that we've outlined would look like. So we find a missed opportunity or a donor registry opposition. So what would happen is we would then trigger an internal notification to our staff, and then we would also notify the hospital key contact, usually, hey, this happened, we're investigating it. And then LifeCenter would have an internal meeting where we would gather all of the information that we had on our side, and we would determine, do we think this is a LifeCenter caused error? Which happens. Sometimes we just totally mess up on our side. And so if it was a LifeCenter caused error, then we would complete the root cause analysis internally, and we would notify you all of that and share a few details about our CAPA and continue conversations around that. If more likely, what we found, we've done a couple of these just as like beta testing with a couple of hospitals. So those of you who have participated, thank you for being our guinea pigs. But more likely what we've been finding is there's actually usually things that LifeCenter could have done better and the hospital could have done better. So if we do find that there was something that we believe potentially the hospital contributed to the miss, we would then come together, communicate that with you all, and we would have a collaborative root cause analysis where we would actually have our quality experts on the phone. We would encourage you to also have your quality or risk or compliance or whomever is the right person in your hospital to participate. And then we would have hospital development staff, as well as I would assume from the hospital, there's been ICU staff involved or whomever would be the appropriate clinical team that would know the details of the actual case. We would complete our root cause analysis, and then we would communicate that out of that meeting saying, okay, here's our fishbone diagram. Here is the corrective action that we've all agreed to, and here's when we're going to complete it by. And then we would continue to monitor that. And then internally at LifeCenter, we'll be reviewing these trends. So if we see a trend at a hospital, then we would be able to maybe get in front of it sooner so that it doesn't continue. So that's kind of the overall process that we've outlined. So there are mutual benefits to this. It does, the new data requirements actually provide everybody more information on how to effectively address and correct these missed opportunities, which is what we all want and certainly what CMS is encouraging us to do. And ultimately, as I said, this will lead to more lives saved. And I don't want to miss the fact that some of these missed opportunities, some of these donor registry oppositions are not always easy. And so regardless of the lives saved at the end, which is very, very important and not to be missed, we also know that we will have compassionate care for that donor family throughout. And that is paramount to what LifeCenter does day in and day out. And that's what we want to work with you all on always. So the lives saved are very important. And we also know that LifeCenter primarily deals with the donors, as is the same for the donor hospitals. So we want to make sure that we're doing everything we can to make sure that that family has a good experience and feels supported throughout the donation process. So as we partner on the missed opportunity and the corrective action process, we will add our expertise. Like I said, we'll be bringing our quality experts to these meetings in order to help assist us with kind of that objective analysis of what was the root cause and what might we do to correct it. We'll also provide resources for the objective analysis and effective corrective action plans. And then hopefully have you well prepared for any audits that you might have for CMS. And certainly, and we've had this before when auditors come in and have questions, if they have questions, we're still available to provide additional information or anything that you might need. But our hope is that you would have everything in hand to really answer any questions that they might have. So what to expect? Occurs, then we're going to follow up with that process that I just outlined. And then your HD program manager, along with support from LifeCenter's quality team, are going to guide you through any steps that would need to take place from there. And really, it goes back to kind of correcting any of those challenges that we outlined at the very beginning that we've been working on for a number of years now, because we know when we do all of these things collectively together, we have better collaboration, we increase donation opportunities, our families feel more supported, and the hospital staff also feel more supported, which is our goal. So I have said a lot. We actually have our Director of Quality and Regulatory Affairs, Sean Farraher, on the call today. So I'm happy to take questions that you might have or any comments. This is always the most awkward part when no one's speaking. But we will be recording this meeting, so you'll have that. We're also sending out communication next week that kind of outlines all of this in written form. Because I know taking it all in a PowerPoint while I'm speaking through it, you may not be able to formulate exactly what questions you might have. So just know that we will be sending out additional information. Your hospital development program managers are all very familiar with this content, so can also answer questions that you might have. And as I said just a few moments ago, if you do have a missed opportunity or a donor registry opposition, we will be happy to kind of walk you through the new process so that we can make sure we're well prepared. All right. Any other? I'll leave one more minute here for comments or questions. Yeah, go ahead. Nick Mayo?
Hi, Rachel. Nick
Hi.
Mayo. I'm Associate Medical Director for Quality and Safety at Harborview Medical Center. Thanks for the presentation. It's great information to have. Just thought I'd break the silence and ask
Thank
a
you.
question if that was okay.
Yeah,
Um,
absolutely.
I'd be curious how you were thinking operationally the Life Center Northwest led root cause analysis would work.
Mhm.
Would you would the quality safety team at LifeCenter Northwest be doing like stakeholder interviews with staffs at the hospital to kind of collect various viewpoints about what exactly happened, and then synthesize that with what they're getting from LifeCenter staff, and then put that all of that information together in a root cause analysis? I guess just be very curious kind of how you were envisioning it actually being carried out.
Yeah, that's actually a great question. So as I said, we trialed this with 2 hospitals already. How we had done it is we had done an internal after action review at LifeCenter. So gathering all of the appropriate stakeholders from the people on our side that had participated in the case. And we had started a fishbone diagram based on that after action review. And then what we did is we met with the hospital staff, which included representation from their quality team as well as their ICU team, and completed the fishbone diagram. So we didn't go so far as to interview hospital staff or anything like that. I think we could also work with individual hospitals to decide like what makes the most sense to do related to how you all normally handle these types of events. But coming out of that meeting, we had pretty collectively identified on the fishbone, these are what we believe to be the primary causes. And I would also say, actually, we did do some interviews of the hospital staff. So I actually participated and spoke to one of the nurses that had participated in the case that we were reviewing. I spoke to the ICU manager and actually the CNO too. So there was some of that just in terms of fact finding on the hospital side. We are just rolling out this process, so we'd also be looking to all of you to say what would be most helpful and how might we facilitate it within your hospital's program so that it aligns with systems you already have in place. And then coming out of that meeting, we provided the fishbone, we provided the action items that we believed both LifeCenter and the hospital should do, and kind of summarized it. And then now we're just tracking action items. I don't know if that was helpful.
That's helpful, Rachel. Thank you.
Yeah. Okay, appreciate that. Any other questions? Okay, well, with that, our next In the Wait Site Champion Roundtable will be sometime in Q2. We have not yet set the date, but we'll be sending that out soon. And like I said, you'll get additional communication around this content, and we'll also have the recording available for anybody who you think would want to see it but wasn't able to attend. Let's see, if there's no other questions, then you all will get a little bit of time back today, which I always find helpful. Let me know if there's any other questions. If not, I hope you all have a great afternoon. Thanks for coming today.